You are leaving work for the day. In the parking lot, you find an unresponsive elderly man laying by his car. Since you are the first rescuer, you must first A. Ensure that the scene is safe. B. Get an AED. C. Open the airway. D. Activate EMS. Correct answer, A. Ensure that the scene is safe. As the first responder on the scene, the first priority is to ensure that the scene is safe. You do not want to become a victim yourself. You find a patient in his hospital bed. He is unresponsive and has agonal breathing. What should you do? A. Place the patient in the recovery position. B. Give 2 rescue breaths. C. Activate the emergency response system. D. Check for a pulse. Correct answer, C. Activate the emergency response system. If the patient is unresponsive and without normal breathing, the first intervention is to activate the emergency response system. Healthcare providers should take no more than seconds to check for a pulse. A. 5. B. 8. D. 10. D. 15. Correct answer, D. 10. Healthcare providers should take no more than 10 seconds to check for a pulse before starting chest compressions. You are alone and find an unresponsive victim not breathing. You shout for help but no one responds. What is the proper sequence of actions in light of this? A. Get AED, check pulse, defibrillate if needed. B. Activate EMS, get AED, check pulse, start CPR. C. Check pulse, CPR 5 cycles, activate EMS, get AED. D. Get an AED, activate EMS, check pulse, start CPR. Correct answer, B. Activate EMS, get AED, check pulse, start CPR. AHA BLS Provider Manual page 15. For victims of any age, the lone rescuer should use the compression ventilation ratio of 30 compressions to 2 breaths for CPR. A. True. B. False. Correct answer, A. True. The universal compression to ventilation ratio for adults, infants, and children when a single rescuer is providing CPR is 30 compressions to 2 ventilations. The foundation of CPR is A. Teamwork. B. Rapid activation of EMS. C. Maintaining an open airway. D. Chest compressions. Correct answer, D. Chest compressions. The foundation of CPR is chest compressions. You begin chest compressions on a 42-year-old male. You remember that the compression rate is A. 80 to 100/min. B. 100 to 120/min. D. 60 per minute. D. As fast as possible. Correct answer, B. 100 to 120/min. When providing chest compressions to an adult, compress at a rate of 100-120/min. When performing chest compressions on an adult, which of the following factors are important? A. Ensure that the patient is on a firm surface. B. Push down at least 2 inches with every compression. C. Allow for full chest recoil. D. All of the above. Correct answer, D. All of the above. All of these are important factors when performing chest compressions. Some other important factors are: compress at a rate of 100 to 120 per minute and minimize interruptions in chest compressions. Two rescuers are generally needed to perform a jaw thrust and provide breaths with the bag mask device. During CPR, two rescuers are recommended to deliver effective ventilation. A. True. B. False. Correct answer, A. True. One rescuer opens the airway and seals the mask against a face, while the other squeezes the bag. Use the head tilt chin lift if you suspect a head or neck injury. A. True. B. False. Correct answer, B. False. If a head or neck injury is suspected, the jaw thrust should be used. You are performing CPR as a lone rescuer on a 60-year-old female patient. Where is the ideal position for you around the patient as a lone rescuer? A. Above the patient's head. B. At the patient's feet. C. At the patient's side. D. Straddling the patient. Correct answer, C. At the patient's side. The ideal position when performing one rescuer CPR is at the victim's side. You can give breaths and perform chest compressions when positioned at the victim's side. For the lone rescuer, bag mask rescue breathing is not recommended during CPR. A. True. B. False. Correct answer, A. True. Two rescues are recommended to deliver effective ventilation with a bag mask device. As you perform two-person CPR on a patient in cardiac arrest, each breath should be delivered over seconds. A. 1. B. 2. C. 3. D. 5. Correct answer, A. 1. Giving breaths over 1 second helps minimize interruptions in chest compressions. How often should rescuers switch roles during CPR? A. Approximately every 1 minute. B. Approximately every 2 minutes. C. Approximately every 3 minute. D. Approximately every 5 minute. Correct answer, B. Approximately every 2 minutes. Switching roles frequently, every 2 minutes, helps reduce fatigue. If the jaw thrust maneuver does not work to open the airway on a suspected spinal injury, use a head tilt chin lift. A. True. B. False. Correct answer, A. True. Quote from manual: if the jaw thrust does not open the airway, use a head tilt chin lift maneuver. After you power on an AED, external automated defibrillator, the AED will guide you through the next steps. A. True. B. False. Correct answer, A. True. An AED analyzes the heart rhythm and provides prompts to the user for steps to be taken. The sequence of the 4 universal steps for operating an AED are: A. Power on, attach pads, analyze, shock, if advised. B. Attach pads, power on, analyze, shock, if advised. C. Plug in ADD, power on, analyze, shock, if advised. Correct answer, A. Power on, attach pads, analyze, shock, if advised. The first step when operating an AED is to turn the power on. After turning on the power, the AED pads are supposed to be attached. After attaching the pads, the patient is cleared and the rhythm is analyzed. A shock is performed if instructed or CPR is restarted. You have attached the AED to a patient in cardiac arrest. What is your next step? A. Clear the victim to analyze rhythm. B. Analyze rhythm. C. Power on the AED. D. Shock the patient. Correct answer, A. Clear the victim to analyze rhythm. The AED is powered on prior to attaching the pads. Before the AED can analyze the rhythm, the patient must be cleared and compressions must be stopped. Shocks are not provided until the AED has performed a rhythm analysis. When using the AED, if no shock is advised, you should A. Press the reanalyze button. B. Check a pulse. C. Immediately resume CPR. D. Check if the pads are attached properly. Correct answer, C. Immediately resume CPR. Do not delay CPR if no shock is advised. Start CPR with chest compressions. Minimizing breaks in CPR improves the chances of ROSC. Minimizing the time from the last compression and shock delivery improves the effectiveness of the shock to result in ROSC. A. True. B. False. Correct answer, A. True. Minimizing the interval between the last compression and shock delivery improves the effectiveness of the shock to result in ROSC. Reducing this interval increases the likelihood that the shock will be effective. Adult defibrillator pads should be used for victims, years of age or older. A. 8 years. B. 10 years. C. 12 years. D. 14 years. Correct answer, A. 8 years. Adult pads should be used for victims 8 years of age or older. Special situations that may arise when using an AED include, choose all that are correct. A. The victim has a hairy chest. B. The victim is immersed in water. C. The victim has an implanted pacemaker or defibrillator. D. The victim has a transdermal medication patch or other object on the surface of the skin where that AED is placed. Correct answer, C. The victim has an implanted pacemaker or defibrillator. All situations listed will require additional actions when using an AED. You may use an AED even if the victim is laying on snow. A. True. B. False. Correct answer, A. True. You may use an AED even if the victim is laying on snow. Quickly wipe the chest before attaching the AED pads to ensure no moisture is present. A victim is in cardiac arrest and you are preparing to place the AED patches. You notice what appears to be an implanted pacemaker. You should A. Do not use the AED. Start CPR. B. If possible, avoid placing the AED pad directly over the implanted device. C. Turn off the implanted pacemaker by holding a magnet over it. D. Do nothing, the implanted device will shock the patient. Correct answer, B. If possible, avoid placing the AED pad directly over the implanted device. If an AED pad is placed directly over an implanted medical device, the device may block delivery of the shock to the heart. Avoid placing the AED pad directly over the implanted device and proceed with the normal steps of using the AED. You may place an AED pad directly over a medication patch. A. True. B. False. Correct answer, B. False. A medication patch may block the transfer of energy from the AED pads to the heart and may cause small burns to the skin. The BLS compression ventilation ratio for 2 rescuer CPR in the child is A. 10:1. B. 30:2. C. 15:2. D. 15:1. Correct answer, C. 15:2. Appropriate compression to ventilation ratio for 2 rescuer CPR in the child 1 year to puberty is 15 compressions for every 2 breaths. You are providing CPR for a 5-year-old child. As you begin chest compressions, you remember that the compression depth should be A. 1/2 inches. B. 1/4 the depth of the chest. C. 1/2 the depth of the chest. D. 1/3 the depth of the chest. Correct answer, D. 1/3 the depth of the chest. Appropriate compression depth for the child 1 year to puberty is 1/3 the depth of the chest or approximately 2 inches. In the child 1-year-old to puberty, compressions may be administered as 1 or 2-handed compressions. A. True. B. False. Correct answer, A. True. Adequate compressions can be provided with 1 or 2 hands in the child 1 who is 1-year-old puberty. You are a lone provider. You find a child in arrest that was unwitnessed. You should provide CPR for minutes before activating EMS and retrieving the AED. A. 1. B. 2. C. 3. D. 4. Correct answer, B. 2. For an unwitnessed arrest, the lone provider should provide 2 minutes of CPR to ensure circulation prior to activation of EMS emergency services. Increased circulation improves the chances of ROSC. You witnessed the sudden arrest of a child who is now unresponsive. You should provide 2 minutes of CPR prior to activating EMS. A. True. B. False. Correct answer, B. False. If the arrest is witnessed and sudden, leave the child to activate the emergency response system and get the AED, then return to the child. The universal compression to ventilation ratio for the lone rescuer with adults, children, and infants is A. 10:2. B. 15:2. C. 30:2. D. 10:1. Correct answer, C. 30:2. The universal compression to ventilation ratio for adults, children, and infants is 30:2 for the lone rescuer. The universal compression rate for all cardiac arrest victims is A. 60-100/min. B. 100 per minute. C. 100-120/min. D. 90-110/min. Correct answer, C. 100-120/min. The universal compression rate for all cardiac arrest victims is 100-120/min. To perform a pulse check in the child, palpata, or femoral pulse. A. Pedal. B. Radial. C. Brachial. D. Carotid. Correct answer, D. Carotid. Palpation of the carotid pulse or femoral pulse is recommended for the pulse check on a child victim. When performing 2 rescuer CPR on the child, compression to ventilation ratio is A. 15:2. B. 30:2. C. 10:2. D. 15:1. Correct answer, A. 15:2. The compression to ventilation ratio for the child victim when two rescuers are participating is 15 compressions to 2 breaths. For most infants and children, chest compressions alone are not as effective for delivering oxygen to the heart and brain than a combination of chest compressions and breaths. A. True. B. False. Correct answer, A. True. Infants and children who developed cardiac arrest often have respiratory failure or shock that reduces the oxygen content to the blood even before the onset of arrest.